Welcome everyone to the Town Hall on Childhood Fall Prevention. What can we do collectively? Facilitated by the Fall Prevention Community of Practice. My name is Shamiza Allard and I'm the Knowledge Coordinator at the Ontario Neurotrauma Foundation, also known as ONF. So ONF sponsors the Fall Prevention Communities of Practice, Loop and Loop Junior, along with the annual Fall Prevention Month campaign. And like always, before we begin, I'd like to just give you a quick rundown of the Zoom meeting platform. So your screen may look a bit different depending on the type of computer that you're using. And if your Zoom application is opened in full screen, you can double click or press the escape button on your keyboard to exit the full screen. You can also click the exit full screen button, right? I'm showing it here on the top right corner of your screen. The webinar technology consists of two parts, which are audio and visual, and both are provided through your computer monitor and speakers. So to test or adjust your audio settings, look for the audio settings or join audio button in the bottom left corner of your screen. And this will provide options for testing your computer microphone and speakers. So now if you look to the bottom center of your screen, you will see buttons that will allow you to access the chat box, raise hand, and Q&A features on Zoom. We won't be using the Q&A for today's webinar. The chat box allows you to send messages to the webinar presenters and other webinar participants, which is what we will predominantly be using today. And you can use the raise hand button if you want me to connect with you through the chat box. And if you need to leave the webinar at any time, click the red Leave Meeting button in the bottom right corner of your screen. So if you have any questions about the technology at any point in time during the webinar, you can type them into the webinar chat box. My colleague Marguerite and I will be monitoring this. Also, you can email me at shamiza.allard@onf.org, and I'll work with you to resolve any of the technical issues. So the webinar is being recorded and a YouTube link will be sent to all participants in about a week, along with the presentation slides. And all other Loop and Loop Junior webinars are recorded as well. And you can view previous webinars by heading over to the webinar page on Loop Junior and clicking Archived Webinars. So now I'd like to introduce our presenters from the National Advisory Committee on Childhood Fall Prevention, Chantal, Stephanie, Cara, and Alain. The National Advisory Committee on Childhood Fall Prevention is formed of provincial and territorial representatives seeking to share information and best practices, coordinate their efforts, and build capacity in childhood fall prevention initiatives across the country through joint initiatives such as Loop Junior and Fall Prevention Month and many others. So now without further ado, please take it away, Stephanie. You may now share your screen.
Thanks so much, Shamiza. Hi, everyone. My name is Stephanie Cowell, and I'm Director of Knowledge Translation at Parachute. On behalf of my colleagues, I want to welcome you today and sincerely thank you for giving us your valuable time. Falls are a leading cause of hospitalization and the leading cause of injury-related hospitalization of Canadian children. And preventing these injuries, the work that you are all doing is critically important. So today we've invited voices from across the country to help us understand how to meaningfully support, amplify, and bring needed attention to this work. Before we dive into the agenda today, we want to have a bit of a sense of who is here with us. So Shamiza will help me with a couple of polls to start. For the first poll question, we want to know what province or territory are you located in? So where are you joining us from today? As a panelist, I am not allowed to vote. I'm very disappointed, but I am joining you all from Ontario and probably like many of you working safely from my own home right now. And here we have the results. We have some great representation from across the country, so thank you. Our largest representation from Ontario and the Atlantic region, but thanks for everyone for joining us from so many different places today. The second question we have is about how much of your current work is directly related to childhood fall prevention? This might be a significant part of your role. It may just be a little part of the work that you do. You may have lots of other demands. So we'd like to know, in your sense, how much of your work, of your role, would you say is dedicated to childhood fall prevention? So if we look at the results here, it looks like some of my work and just a little of my work is the most common response. To be honest, I have to say that that's not surprising. And that's one of the reasons that brings us here today, is understanding, you know, this may not be a role that people identify with as, you know, a full-time worker in childhood fall prevention, but how do we still leverage your role, your perspective, and the work that you're doing to really, you know, build up our capacity in this area. So thank you all so much for sharing that. We'll move in to talk a little bit more about what will happen today. We are going to begin the agenda with a short presentation by Ellen. She will review the environmental scan findings, implications, and recommendations. There will be opportunity at the end of Ellen's presentation for a Q&A. So as she's speaking, please feel free to enter questions and comments in the chat box, and we will definitely have some dedicated time to address those, and Chantal will help facilitate that discussion. The remainder of our time here will be spent on a guided discussion. Kara is going to facilitate that, working us through some questions we'd like to put to all of you and open up a discussion that will sort of drive us to some next steps and priorities for moving forward. The goal for today is to accomplish the 3 objectives you see on your screen now. We want to build amongst this group a common understanding of the Canadian context of child fall prevention work, understand the existing capacity and how we can build capacity for this work. We also, really importantly to have you here for this one, is to understand Canadian practitioner perspectives. Some of this has been captured in the environmental scan, and we're going to continue building on that in discussion today. And finally, quite likely the most important part of today is identifying some collective actions for fall prevention. What can we do? Who do we need to engage? How can we move this work forward? How can we bring more attention? And what are the opportunities we have to drive this forward? So these are our goals to accomplish today. And thank you once again for joining us and helping us work towards these objectives. So now I will hand it over to Ellen, and Ellen is going to provide us an overview of the environmental scan that was conducted and what findings resulted from that piece of work.
Thank you, Stephanie. It was a great introduction, and like you, I thought it was interesting to see the amount of work dedicated to this issue, which most of you are involved, but at different levels. And as Stephanie mentioned, it's certainly not a surprise on the basis of what we found through the environmental scans, which I will start with the first scan to go through what we uncovered. So the first scan was released in March 2020 and very much prompted by the level of activity in Loop Junior, which is the online community of practice on childhood fall prevention, whereby the assumption was made that there would be a great interest and participation level, and that people would share information. But it was certainly obvious that we did not necessarily know who was doing what across Canada in terms of childhood fall prevention. And there was a need to have this scan and to inquire further about what is currently happening and use this as a resource to foster inter-organizational collaboration and planning. And so for those of you interested in reading further, I will just highlight the main content of the first scan, but you can find it on the link in my presentation slide right there. And the slides will be available, by the way, at the end along with the recording. So the scan provides a few features. So definitely we wanted to understand the nature and scope of fall-related injuries in children, and along with the risk factors and the risk conditions. So that was the first order of business. But also, where are the evidence-informed practices, programs, and environmental supports across Canada? Who is doing great work, and what is it, and how can we share it? So it was, we were quite intent in finding that information. But also it was pointed out that we cannot be speaking about childhood fall prevention without touching upon the two topics or concepts of physical literacy and risky play. So we tried to highlight some of that content in the first scan as well, knowing that these concepts are very much connected. And we ended up identifying key Canadian organizations that do work in childhood fall prevention initiatives across Canada. And they are listed in the scan, and along with the scope of the work that they're doing. And at the end, we did ask, what could be some of the priorities in terms of what we found in the literature, what we found through the organizations? And it was pretty much, without going into details, they were very much focused on intervention research, like the effectiveness of the interventions. Are there some evaluations? There were recommendations about municipal policies on playgrounds, as well as education of parents and caregivers. So it was not like connected recommendations. They were very targeted on specific issues. So given the first scan, we thought, okay, let's say that the action is not quite obvious from the first environmental scan. There aren't clear action steps to take. It's certainly good to know the information that we did find out, but it was not answering all the questions and certainly not identifying what could be done collectively. So this group, the Childhood Fall Prevention and National Advisory Committee, many of the people who are here today as panelists and committee members who are participants at the moment. So this group embarked on the discussion about what does the first scan say that maybe we haven't picked up and that we should ask people about, and what are their perspective, the practitioners who do work in the field. And so that's how we came about with having a second scan that would update the first one, but diving a little bit deeper in the context. So I want to point out that the second environmental scan was released in March 2020. Why is that relevant? Because it certainly was answering some questions, and it was certainly giving us the perspective of the practitioners, and giving us some feedback of what they thought of the first environmental scan. But we all know that things may have changed. And this is going to make this discussion after the presentation quite even more so relevant because of the unknown. So what we did do in the scan was, or the purpose of the second scan was to find out what were the reactions to the first scan, what were people's perspectives in terms of their networks, collaboration, the work that they're doing in childhood fall prevention, and some of the challenges they're encountering. And by doing so, we were able to update some of the resources as well and key contacts, which was useful. We started off with the members of the National Advisory Committee that you saw in the previous slide, and we did kind of a snowball approach to doing some key informant interviews. So in total, there were 21 interviews, and we used a method of open-ended and semi-structured questionnaires with 7 questions, and the informants, all the practitioners and participants were representing various disciplines and perspectives, and those are the ones listed there. I also want to add that in the context of one meeting for the Ontario Injury Prevention Committee that is very Ontario-based, we did seek their input by doing a bit of a conversation within a meeting to see if they had a different perspective, and that was included in the scan as well. So let's move to the findings. Again, I'm gonna briefly go through the findings, and because I think the conversation we want to have after is what's key. So one of the findings was that there are definite differences between falls in older adults and children. Not that this is a surprise to anybody, but the issues that did come up, and the main issues were the awareness of fall prevention in older adults versus children is not the same. And in some cases, it's almost dismissed for children. Why? Because it is often say, well, we do expect children to fall. This is part of their development. So it's not necessarily a focus as much. And the other part was, well, given that, should we focus on the degree of injury? And should it, instead of talking about preventing falls, because not all falls will lead to great injuries, and maybe it should be serious injuries. So that was a point that was raised as well. And definitely the key informants did mention that there was somewhat of a competition for resources, and that we all know that the focus right now is more so on falls in older adults than in children. And there isn't quite a consolidated approach to childhood fall prevention in terms of priorities as well. So, and earlier we mentioned the field of fall prevention in children, and many people debated that it may not be a field per se as a focus, and that maybe that's what's skewing the conversation. So that was part of the comments made by the respondents. And no surprise, people commented that there are many silos and categories of silos, and particularly around jurisdictions. For instance, where are the adoption of policy and practice? It's very piecemeal. It is done on the basis of some issues that are raised per province, territories, or simply through ongoing potential politics that do come up with, or body of evidence that raise an issue more so than another. So it's not very connected. And speaking of connections, it doesn't seem to occur either in terms of the mandates and the organizational relationships. So the connections are often more informal than formal. There's often staff specific, so it's a person working in the field, and it's based on the relationships they had forged. So it doesn't sound like very sustainable piece of work that is done through each province and territories. And then there was the issue, people commented on health and public health not being connected around fall prevention in children, and that it's as if childhood fall prevention has its own silo, particularly because sometimes what was mentioned is that we talk about childhood fall prevention, and other agencies or organizations talk about safe and healthy kids. So that has a little bit of a disconnect occurring. And of course, another finding or comment that was made by the participants was the whole principle of balancing risk and play, and what does that mean? And what does that mean when we are talking about that? So of course, it varies in terms of, people use risky play, others talk about active play, unstructured play, physical literacy, harm reduction, and sometimes it contributes to a bit of confusion when really we want to highlight the need to talk about safely taking risk versus avoiding serious falls. So we have to keep that in mind. And that also that the issue raised around that was around parenting. And that's where the conversation needs to happen at that level, because often the whole issue of preventing falls in children may not be necessarily resonating with everybody, as opposed to the healthy child development. And there are some practical challenges across Canada, and they vary by province. And that's why it should prompt a national conversation so that we can maybe overcome those challenges. Another topic that came up was the topic of vulnerable populations. So we recognize, the participants recognize that it is a different conversation when you talk about vulnerable populations, and there should be other considerations taken into account. So when you talk about childhood fall prevention and childhood falls, in some cases in vulnerable populations, there are broader issues to be addressed, and more so like community safety at large. And what do we mean by that? Maybe in some areas, in some communities, it's issues of crime, traffic, fires, many other issues that may come first and that may need to be couched in that broader context if we are to address childhood falls. And it's definitely something that if we do take into account, we should be focusing on working together and building trust with populations who are in that situation. So for instance, some participant mentioned that the concept of risky play, for instance, may not appeal to vulnerable populations because they have to attend to broader community safety issues. Other topics that came up were the need to address some very practical challenges. For instance, when we talk about implementing social policies, we should definitely focus on policies that are meaningful and that are contextually relevant policies to the communities that we are working with. And there are some good examples of work being done that were highlighted in the scan, particularly from the Atlantic Center for Injury Prevention around structural determinants and injury prevention. So this information is highlighted in the scan as well, the first one and the second one. And it was suggested that it would be important to get the attention of stakeholders working in active living. The reason that was mentioned is that people working in active living may not necessarily always think about preventing falls because it's just not the lens that they're looking at, and maybe those connections need to be made more, a little bit stronger and more official. And of course, there are informal and formal collaborations that we need to have, that we need to explore, and as a suggestion. And we have to recognize the changing system landscape and structures. And I think that was relevant in March 2020, but now it may take on a totally different meaning because what I would be interested to know post-March is how many of the organizations listed and the work that's being done, if that is still ongoing during the pandemic, and if those organizations are still around. So that will be interesting and discussion to have. And someone mentioned as well that one of the challenges is the difficulty in identifying who's working in the field. In some cases, as you saw earlier with the poll, is that those of you working in the field are working in preventing childhood falls, somewhat a little bit part of your work, medium size, or it's not necessarily the full extent of your work. And that makes it difficult to identify who are the individuals working around this issue. And of course, that's always a recurring theme to the need to have sufficient resources and make sure that when we don't, that we have really clear priorities, and making the information culturally relevant. So out of the scan, the second scan, there were some recommendations that were made by the participants that were trying to address all the challenges that were mentioned and take into account the context that they work in. And one of which was, well, maybe it's time to address childhood fall prevention in the broader context and talking about child safety and situate childhood fall prevention within that. So that's a general recommendation that we may want to chat about and what that means. And also, it would be important to bring the differing schools of thought together, particularly when it comes to the whole issue of balancing risk and fall prevention that we discussed earlier. And sometimes it was mentioned the issue that some standards that are particularly around playgrounds may be overly restrictive. What does that mean? And that should be something that we should be talking about collectively. Other considerations that were brought up is what would be the approaches that would allow us to break down the silos? And in ways that injury prevention, because it's so stratified, we should rethink how we are doing the work and what are the implications for childhood fall prevention at home, play, and school environment. And other things to think about is whether should we be talking about preventing all falls or just focusing on serious falls in children? So that question was raised. And would it make it easier? Is it something that would be worthy of focusing on? That may be part of the conversation that we have as well. In addressing the issue, maybe we need to examine how certain aspects of the childhood fall prevention can be addressed. And as we mentioned earlier, some people mentioned maybe it's in the context of child safety, maybe it has to have a more holistic approach to be addressed. And maybe that's the way that it's gonna cross, we'll be able to do the work across jurisdictions and sectors. And also the whole issue of data and the media particularly. So we know that often enough, when the issue of childhood fall prevention is brought up is on the basis of singular indicators and media focus that may be just in one area, that make it complicate issues, that may be too narrow and not sending the right message. Giving you a little bit of an update on that, I can let you know that there is a group currently working on fall prevention indicators or fall indicators for children 0 to 9. And their name is Allison McPherson and Sarah Richmond. And their work should become to fruition in 1.5 years, as they are currently investigating those indicators that might be helping us telling a different story in the future. And as I mentioned earlier, maybe we need to examine community safety as a whole for newcomers, immigrants, and refugee children. Maybe it requires a different approach, or maybe that approach is needed for everybody, but particularly so with a targeted focus on vulnerable population. And there were some suggestions of how could we work together. So that was touched upon, and I know that's going to be the focus of our conversation as well, but there were 2 suggestions brought up. And one of which was, how can we broaden the conversation? So how can we connect with other practitioners that may not always be involved in the issue of childhood falls, and other sectors as well? I know it's not listed there, but it was mentioned, whereby it's not only disciplines, but sectors, and maybe that's a time to have a broader conversation across Canada. And also there was the comment of, well, there's some work currently happening, and we know that the Public Health Agency of Canada is addressing the issues of windows and balconies, and I think in partnership with researchers that I don't remember from where, but that we should be building on that work, particularly when there is work occurring in specific areas of childhood fall prevention. So that was, I know it's a little bit of an overview of the scan. That's broadly the findings, and that was very rich in details, and more information can be found in the scan. And what I can invite you to do, for those of you, we're currently formatting the second scan. The first scan, as I mentioned earlier, is already available on the website, but the second scan just needs finalizing. So if you want to send me, if you want to include in your, send me an email, and I will make sure that you get it once it's ready. Thank you.
Great. Thank you, Hélène, for sharing that great overview of the environmental scans. We now invite participants to ask any questions or any thoughts that have come up through some of that discussion and some of those presentations, to encourage you to use the chat box to pose any questions that you may have. That'll be before we dive into our next session of the town hall. Any initial thoughts or reactions to what was presented just now that folks want to share on, or do we want to wait and kind of go into our next session about the town hall and discuss there? Not seeing anything pop up.
That's okay. You can send me an email. I will send you the document, no problem. We can get into the conversation.
Sure. So I happy to pass the next round over to Kara, who's going to lead us in a bit more of a facilitated discussion.
All right. Well, thanks again to everyone for joining this chat. So because there is just so many folks on the line today, we'll just get you to put your comments, your answers to any of these questions in the chat box. If we're not seeing a whole bunch of chat in the chat box, then maybe we can unmute some lines. And if you're comfortable in speaking, please go ahead and do that if Shamiza unmutes you. So the first question is, what do you think needs to happen for this work to gain greater visibility and importance? So what do we need to do here to make childhood falls more visible across those jurisdictions, those silos, across public awareness? Seeing lots of good comments come in the chat box here. Just as you're thinking about some answers here, I'll just give a little story about thinking about falls. Personally, in the work that I do here in Saskatchewan around education and awareness is generally with childcare centers, facilities that host parent groups, that type of thing. And so I went into an organization that leads a parent group, and the majority of them were newcomers to Canada. And so we were talking about child safety in general. That was sort of the topic. I don't get requests for presentations on childhood falls specifically. It's always embedded within child safety. And so once we got talking about, poison prevention, all of these other topics around child safety, then we got into fall prevention. And I quickly noticed that with this specific population, that the way that they learned about parenting in their country of origin was very different from what we do here in Saskatchewan. And so their response to preventing falls was very different than, groups of other parents that I've spoken to that originate from Saskatchewan. So that was very good. All right, so just in response to this first question, what do we think needs to happen? Some of the things are definitely around those recommendations from the scan. So as people are saying, broaden that conversation, strengthening the linkages among partners. Campaigns is one. Again, data, we will always keep that in mind. That's for sure. And again, having better media coverage for sure. So those of us that are working in the field to be responding to some of that, that's great.
Hi, Cara. It's Stephanie. I apologize for interrupting
okay.
your moment on the stage.
No.
We're noticed just a technical issue in the chat box. We realize that a number of the comments have come through just to the panelists, and the attendees can't see everything that's written.
Oh, okay.
So maybe Cara, if you could read a few of the comments directly, and also everyone participating, just check when you're typing a message that where it says to and there's a blue box, it's to all panelists and attendees. And thank you all so much.
Perfect. Thanks, Steph. Awesome. So one comment here is that we need to know who else in my region or area is working on or interested in falls. And yes, that's, I think, part of the goal of this conversation today is to make those connections for sure so that we can collaborate. We have a comment here. I like the idea of a national campaign for all children, especially inclusive of newcomers, immigrant children, refugee children, to help educate and prevent falls. Falls are the #1 reason kids are hospitalized. So what are those injuries? So again, they're talking about the severity. Education and awareness of concussion. For sure, concussion is a major topic when we're talking about falls, absolutely. We have a comment here. I can imagine from a non-injury person's perspective, preventing a fall seems a little unrealistic. We need to reframe the issue. And I would totally agree with that comment, because when I think about falls, I think about, you know, at first I was like, well, yeah, as Helen said, we, you know, what are those falls? You know, it's part of growing up. Everybody falls, right? Everybody has, and what's the big deal? And so, yeah, when I do talk about preventing falls, you know, I'm usually referring to the severity. And so, you know, is it a fall that is ending the child up in hospital? Is it a fall that's being treated at home? Is it a fall that, you know, is ending in death? You know, what type of fall? And so then looking a little bit further into what are the conditions. Are they falling, you know, from a great height? All of those things. So really making all of those factors really clear when we're talking about the issue. A couple more comments. Link with boards of education, daycares, camps, etc. Yeah, again, getting across all of those jurisdictions, across all disciplines for sure. All right. Okay, I think we can move on to the second question. So what opportunities for collective action come to mind, and who should be involved? Oh, there we go. Okay, so a couple of comments are coming in here on this one. So making that connection between risky play and teaching kids to assess risks and preventing falls and injury, 100% agree with that. You know, teaching the basic concepts of what is risk, what is hazard, what is danger, those types of things for sure. A national campaign or standards best practice would reduce the local pressure to create something locally. Local public health is limited in what they can do now because of COVID. And yes, that's certainly a consideration in the time that we're living in. We definitely have limited capacity to create and implement programming around childhood falls because of COVID, for sure. A suggestion has been a media campaign with shared messaging. And yes, that's something that we've been talking about, is that we all need to get on the same page when it comes to preventing childhood falls and share those common messages across Canada. Absolutely. Many partners could be involved, especially schools, local safety villages, daycares, and parenting groups. Yep, 100%. And again, Sandra points out that it depends on what type of fall or what kind of fall that you want to prevent. If it's from windows, then we need to bring in the building code folks, governments, etc. For playground falls, we need to bring in the schools. So really knowing who we have buy-in with, who are the key community partners and leaders, those types of things, and to have that clear prevention messaging. And again, yes, it's about collective action and being very mindful of the language that we're using and having those consistent messages. And again, keeping in mind that local context for sure. So yeah, I mean, even if we have something that goes across Canada, you know, how does that apply to us, either within our daycare community or within our provincial or within our region, that type of thing. Also ideal to include local researchers and be involved to provide relevance for local communities. Yes, yeah, for sure. You know, translating that knowledge needs to be relevant, and we need to speak the language of the people that we're working with, for sure. So is there anybody that we've missed, you know, who we can engage with? Who are those other folks? We've mentioned researchers, we've mentioned daycare, we've mentioned government. Who are those other folks that we've missed that we might want to engage with to bring the idea of preventing childhood falls to the forefront? We've talked about media. Connecting with parents and caregivers, yes, absolutely. Healthcare providers, yeah, public health, yeah. Owners, operators of playgrounds and sports associations, yes, that's one. And when Hélène was doing the presentation, that drove it home for me. I'm on an active transportation working group here in the province, and we were having our last meeting, and we were talking about incorporating falls prevention into that. So yeah, that's a good one. And one of our working group members is on is the director of recreation for the local town. So that's one area that I never thought of before. Could we include Special Olympians and children with disabilities as well? Absolutely, that's an area that I did not think of previously. Sandra comments, I think a better definition of falls, you can fall anywhere, but what does it include? You know, does it include sports? Does it include in the home, etc.? So really describing that for folks, I think that's key. And then apartment owners, managers, homeowners, when it comes to window falls. Yeah, for sure. I mean, falling out of a 15th floor apartment versus falling out of a window in a bungalow is very different. And then Cindy comments that the Prevent Child Injury team has started a good base, and could this be added to? And yes, I think we certainly link to the Prevent Child Injury team a lot in the work that we're doing. So that's a good reminder. And then again, another special population or vulnerable population would be low-income housing, to add to the Window Falls piece for sure. Okay, again, another comment in terms of who should be involved: municipalities and public works, road, sidewalk infrastructure, absolutely. Okay, Helene, if you want to switch to the third question, I think we can get on to that part. Thank you. So what question, oh, this went too quick. What questions about preventing childhood falls do you have? And what can we follow up with? So when you think about preventing childhood falls, what comes to mind? What are those questions that you have? As I said, the first time I ever got into, incorporating falls within child safety, it's like, okay, well, who's falling? Where are they falling? And what injuries are happening to them? And how serious are they? Those were my first three questions. So we've got a few comments here. Perhaps the language should be more strongly about preventing injuries from falls, not so much preventing falls. So preventing those injuries. Okay, that's a good perspective. What is the age range for specific injuries we are trying to prevent? Okay, good question. And then different mechanism of falls depending on age. So often we think about young children, so maybe children under 5, but then what about those 10 to 14-year-olds? So are they falling, are they jumping off of cliffs into water and that's the fall? Those types of things, yeah. So we have a comment here. It would be a big job to convince ordinary adults that falls might be normal, but serious injuries from falls are not. Messaging to that effect is needed. And of course, always looking for best practice programs. So that's definitely a big question, I think, on all of our minds, is what are those, what is the evidence telling us? And then how do we effectively communicate those prevention strategies, for sure. How do we engage children and youth in prevention? Lindsay, that's a great question. And that's one that I struggle with always. So in any of the presentations that I've done around child safety, it's always been for adults, for parents. And I've never had a tangible hands-on activity that I've done with children and youth. So that's definitely a great question. Okay, and so we have another comment here about this type of society that we live in, with the different type of parenting styles and strategies, helicopter parents, free range parents. And so getting parents' perspective on safety would be useful for sure. Yeah, opening up that conversation. And again, that's easily identifies the local context as well. What's going on regionally. Okay, another comment around engaging children and youth, that there's an opportunity to incorporate physical literacy activities and partnering with the physical education and risky play people. For sure. I definitely, Sask in Motion here locally is doing lots of education around physical literacy. So your local rec, even schools, how do we incorporate preventing injuries from falls, in high school phys ed classes, for example. People talk about the good old days when unsafe play equipment was fun. There's an attitude today that kids are bubble wrapped. So somewhere between past foolish behavior and current overprotectiveness, we need messages that are acceptable to both sides, not an easy marketing job. Yes, and we've got an agreement with Marguerite on that comment for sure. Whenever we do, this isn't around falls, but it's around other injuries with children in car crashes. Well, we never had car seats when I was young. You hear those stories, right? And so how do we as a community respond appropriately when we hear those types of stories? Yeah, I got spun off the merry-go-round at the playground a million times and landed on my head, right? And I'm fine, right? So how do we respond to those types of things? Question, is there an increased fear of injury severity due to heightened social media presence? Yeah, with social media, we have, huge opportunity for people to tell their story, right? So does that create fear, or does that create a lesson learned? Okay, and then Marguerite has a comment. Since our biggest half of fall prevention is for older adults, we might consider more messages from grandparents, maybe intergenerational strategies and messages. That's an opportunity that we can connect the dots for sure. And then impact of COVID-19 on injury types, maybe not as much outdoor play due to shutdowns, and increased in home-based play equipment, trampolines, etc. And yes, we've seen that trend happening, and we've heard reports, certainly from folks saying that, bikes and trampolines and all of those types of things that people can buy for their homes have been in high demand during COVID. And, parents are using them because they're trying to balance working from home and doing childcare at the same time. So, they're getting their kids as many of those items as possible. Okay, I think we can move on to the fourth question now. So, what opportunities do you currently have within your realm to share information? So where are you able to connect? Excellent, good promotion, Sandra. Loop. Use that platform. Use Loop and Loop Junior for sure. Social media, Twitter, Facebook, your own personal organization's website. Yep. let's capitalize on all of those connections and networks that you have. So let us know who those people are. Zoom presentations. Yep, that definitely within COVID, we're doing things virtually. Childcare and family centers for sure. Here in Saskatchewan, we have family resource centers. I connected with them just this week. Locally with community partners, schools, daycares, child family centers. Yep. I'd like to know the best way to mobilize when we have opportunities to act and advocate. How do we reach everyone as quickly as possible when we have a time-sensitive call to action? Anybody have answers to that question from Stephanie? So opportunities with emergency departments, municipal parks, playgrounds, and community partners. Thank you, Wendy. Social media, the Child Safety Link website, Canadian Collaborating Centers. So that for the connection with professionals. Yeah. And Sandra commented that she hopes that the national conference goes on. So for those of you that were aware that we were hosting the 5th Canadian Falls Prevention Conference in Saskatoon in June, got canceled due to COVID, is now being rescheduled for November. And we have a planning committee working on that to do that conference to go virtually. So plans are in the way, so keep your eye out for messages for that virtual conference. So creating a list of local advocates to help when opportunities arise when it comes to mobilization. Yeah. Committees and networks that are already in place, and try to communicate in a timely manner as needed, for sure. At the Saskatchewan Prevention Institute, we did a video on trampoline safety within the last couple of years. And we engaged with a local emergency room physician to develop that video, as well as the epidemiologist to get the statistics for that video. So those are two opportunities there. So you can engage with your local emergency room physicians. And then my question was, okay, so when a fall off of a trampoline or on a trampoline happens, and a child comes into the emergency room for a fracture, yes, the emergency room physician or the orthopedic is going to deal with the injury itself. But then what's the message to the child, to the parent, to the family about preventing future injuries? So just a sort of a follow-up to this question before we move on to summarizing things. I just wonder, so within these opportunities, are there specific barriers or something that's preventing you from sharing information. One barrier that's been identified is a lack of specific data. And yes, that's definitely, we see that evident, that there's not a consistent data collection. Or I guess maybe timely data, right? So it's hard to get that data out that's relevant within a shorter time frame. Carolyn says, I wanted to share a wonderful PowerPoint slideshow produced in Saskatchewan. However, my health unit would not give me the okay to follow up and use it or find ways to adapt it. I was sad and disappointed. Oh, I'm sorry to hear that. Send me an email, Carolyn, and we can talk about that. I'll put my, send you my email address. Okay, CHIRP data has some qualitative information. Yes, it does. It's not all across Canada, unfortunately. Sorry, I lost that comment. Where'd it go? Here it is. Underused resource. Yes, for sure. Okay. Might be interesting to look at the aftermath of childhood injuries 10 years post-concussion, or the cost of dental care 10 or 20 years after the initial injury. Well, that's a good comment around dental care. I never thought about engaging a dentist, the dental community. Helen says, the scan did mention that it's difficult to identify who works in preventing falls among children. Yeah. Okay. Oh, this is a comment I never considered previously. I took my child to the ER once after a fall at a birthday party and was quickly separated as they wanted to ensure I had not been the one to hurt my child. This was a feeling I will never forget. My child was separated from me and I felt like a criminal. I get that child abuse happens, but I was almost in tears. Yeah, the emotional toll on families and the policies that are at local hospitals. Yeah, how do we deal with that? Yeah, that's a really good comment. In terms of another barrier, the capacity to mobilize the data. So whose job is it to incorporate or mobilize that information? Steph, do you want to unmute and talk about the cost injury report briefly?
Sure. Sorry, I just had to find the right window. Yeah, so we are, the last cost of injury in Canada report came out in 2015, presenting 2010 data. We now have funding from the Public Health Agency to produce a new national report in 2021. And we are working with 2018 data, which is a fantastic update. Our challenge there is not yet funding to do provincial level reports or some additional pieces. However, we're still working towards that. But from a knowledge translation perspective, we are thinking ahead about when we release the report. Are there particular topics or populations or issues we want to raise? And how can we share that information to make sure it's well used. We have in the past, we did do, I can't remember what we called it, I guess a compendium addition to the last report, looking at, I think, child falls and child transport injuries. But knowing that some new data is coming, what are the opportunities that we can think about now potentially to incorporate and leverage? And in addition to that, I appreciate Carolyn's comments. I think the challenges of capacity and then funding resources is also an issue that would affect the role that Parachute can play in some of these issues as being a centralizing force. So I think finding concrete opportunities to pursue funding to address some of these areas would be helpful. And we do find that presenting funding opportunities as a collective, so working with provincial or community partners, can be a big boost to these funding pursuits. So, you know, if through this group and other opportunities, we can really come together with some concrete things we want to accomplish, that would help with pursuing funding and other resources to help us actually take on that work.
Okay, so we have about another 20 minutes or so for this town hall. And I think we're at our last question.
Yes, it's Hélène. Can we talk about priorities?
Perfect.
Perfect, great. Thank you, everybody. So I just wanted to add a bit of information when I mentioned the data. I know it came up a fair bit because it is difficult to tell the story of falls in children due to the data not necessarily, or the indicators not necessarily being the same across Canada, or even present, or maybe not sufficient. So as I mentioned earlier, the researchers that ONF funded are working on that. They're starting off with doing an environmental scan of those indicators, and similar to what was done for older adult falls. And once the environmental scan of what is it that we're using in terms of indicators across Canada, that once that's done, they will look into, okay, so we know about these indicators. They will consult with people in the field, and they'll ask, but what else should we measure, and what other indicators should be added if these indicators are not telling the full story? So there'll be a two-part to that work. So as I say, that they're in the early stages right now, they're doing the scan, but we hope that they'll have some information to bring to us that we can inform further for their research. So that being said, I certainly invite, at this point, we want to have a sense of what needs to be done. So a sense of priority setting and what next steps could be. So I do invite my colleagues, panelists, to pitch in if they saw some trends as the conversation was going. I certainly picked up on the information sharing and data trend. And so anybody wants to bring something forward in terms of what should be at least a short-term priority at this point and maybe medium-term?
It's Chantel. One of the pieces that came out quite a few comments, but also essentially some of the basis of our town hall today was scaling back and really identifying what children's falls in this case is, the definition, what it means, what components go into creating that, quote unquote definition of a childhood fall. I think that certainly helps folks then identify within their own work what it is that they're doing or how they could maybe apply that to the work that they will then carry forward.
Yeah, and I see that somebody agreed with you, Patty, certainly agreed with a unified definition of falls, refocus on those falls that result in serious injury. And also Sandra mentioned rebranding of fall prevention for media and education. So maybe couching fall prevention in some other ways, potentially child safety or depending on the issue, I assume. Any other suggestions for priorities of action? Jennifer mentioned injury prevention may resonate more for children, parents versus fall prevention. Yep. Not only what injury or what falls are, but who are we targeting in that information? And best practices, that keeps coming up, yes. Certainly the first scan did look into what are the best practices that we are aware of, and they weren't that many. So maybe, I don't know if it's an awareness issue or the best practices are not there. So that's certainly something to look into. So in terms of, I hear a lot about redefining, rebranding, repurposing, and knowing what we have in some respect with the best practices. Some of the environmental scan information did get to that. Marguerite said, definitely agree with both Sandra and Patty. We have an opportunity with children and the image that they are cute and cute cells. Look at the ads that were amps or that were amps too. The children are delightful. You can see that with effort and prosthesis, they are winners. So it might be a question of, again, rebranding and looking at how we communicate. We really appreciate the Loop conversations and opportunity to connect as well. Thanks for providing this forum and the Loop. Thank you, Carolyn. And maybe there is an opportunity to have further discussion. I mean, we certainly had quite a few participants today, but it's not unmanageable. And maybe we can speak on how we stay connected and keep that conversation going. In terms of, we also need to look at the built environment and passive approaches to fall prevention from Sandra. And Cindy said, if PHO, Public Health Ontario, could break down the fall data a bit better to help regions prioritize the issue. And okay, perhaps we should invite the communication departments at Public Health and other agencies to a town hall. Oh, well, that's a, yep, definitely a different lens here. Any other suggestions? So I see a bit of a theme in the suggestion. So we seem to want to have a better sense of what's going on and maybe rebranding and rethinking the issue of fall prevention among children and looking eventually, you know, how we can find that data, how it can be better used and better purposed. What data are people most interested in if we want to advocate to improve data sharing? Good question. And that will be part of that conversation, Stephanie, whereby when we have a sense of what are the indicators that we are currently using because right now I'd be a bit at a loss to know where they are across Canada until that work is done. And maybe that's not enough. And maybe they're not telling the right story. Any other comments? So in terms of what I can tell you, if there are other comments do come in, I will address them. I want to give you a bit of a sense of what some of the next steps are on after this town hall. So of course, the first step will be that this committee, the National Advisory Committee, will meet again and we'll take all this information and organize it in themes, trends, and suggestions and priorities, and see how we could move forward with this. And certainly there'll be an opportunity. We already mentioned the, and I think it was mentioned, but if not, we'll make sure that it is mentioned, the virtual conference on fall prevention that will take place, organized by Parachute, and taking place in November, from November 16th to 20th, whereby Cara and I will be having some opportunity to present, and we certainly can open the discussion to follow up on this. We will have a sense of, we'll bring forward what you said during this town hall. There'll be a bit of a presentation again of the scans, like really quickly, but mostly what people are discussing, and feed and ensure that this discussion there's more opportunity for additional input if there are other participants. And certainly from there, we can build a bit of an action plan. And also maybe there is the potential to have this kind of conversation again, maybe through a different format than webinar, maybe Zoom if we are a small group, but certainly the ability to keep the conversation going. So those are the next step that I can think of. What do my colleagues, do you have anything else to add? Or Stephanie, do you want to talk about the virtual conference? I think there's a save the date coming up soon, right?
There is a save the date coming soon, yes. Okay, so we'll make sure that everybody gets it. Lindsay mentioned we have the Brainwaves program for brain injury education awareness for older elementary students. Can we take data and best practice information and develop ready to go type programs for fall injury prevention for multiple age ranges? Oh, that's a big endeavor right there. Good question.
One of the other things that I just wanted to mention was that if people aren't aware, which I'm sure everyone on this call is, that November is Fall Prevention Month. Yes. So if you haven't visited the Fall Prevention Month website, please go ahead and do that, and start thinking about the activities that you will do to recognize that Awareness Month. And where are those opportunities that we can collaborate? So get in touch with either any one of the members of this committee or each other that are on this call. Let's see what kind of creative and fun things that we can do this November.
And that's a good point, because from our end, we made sure that many of the activities, because if you recall in the past, the Fall Prevention Month campaign was providing activities that you could download and with the instructions and everything, but they were mostly face-to-face activities. And now we've customized most of it, I would say a good 95% of the activities with a virtual component. So should you be interested in having activities, there's a section on that on the website. It tells you which kind of activities and how you can do it virtually for this year, given the situation we're in. And if you're not able to do an activity, so there's certainly the capacity to have some being engaged in social media. And there are many resources that you can use on the website to do that. Any other comments? And thank you for adding the details, Shamiza, in the chat room. So before you go, we do have a few questions to ask you. And Shamiza, I think that you're the one who needs to, do I have to stop sharing my screen? Oh, here we go. That's perfect. So we have a few questions to ask you. So was this town hall useful from your perspective? Yes, excellent. Good to hear. So that will certainly be part of what we consider in the future. Next question. Are you taking anything from today that you will bring forward to your work?
And if you have something specific that you are taking away, you can, if you feel comfortable sharing that in the chat box, that would be great.
Excellent. Yes, don't know. That's fair enough. And the next question, which is the last question. Again, if you say yes, and if you're interested to be part of this, and we're certainly going to come back to you to provide you with a summary of the chat room discussion and a bit of with categories and that we can make sense of. Great. And since I don't see names appearing in the chat box, I'll assume that you're all interested and that we will be, we know who was part of this town hall, so we certainly can stay in touch. Oh, thank you, Jennifer. Great. And don't hesitate to put your email address for those of you who are interested. And we'll make sure to connect. And as I said, the next step is to, for the National Advisory Committee to meet again and discuss those steps. And don't forget about the virtual conference on fall prevention coming up in November as well. Does anybody else have anything else to add? My colleagues?
I just wanted to say thank you to my colleagues for the presentation today, for putting everything together, and also the participants who attended. Thank you so much for your feedback, because this definitely helps us move forward.
And for the conference, I just have a quick question. The virtual conference will send you the save the date, and all the information to sign up will come in the near future. Thank you, everybody.
So I'm going to take it over from here. So thank you, everyone, for this, well, extremely informative presentation, and also for leading, a great discussion about childhood fall prevention and some of the gaps that are quite evident. And also thank you to all of our participants for joining in and being obviously so engaging. So as mentioned, the National Advisory Committee on Childhood Fall Prevention will be compiling all of the information from this town hall, and we'll be identifying some next steps, including a summary of discussions. So stay tuned for that. And as I had mentioned earlier, the webinar recording and slide deck will be posted on Loop Junior, but I do encourage all of you to continue this conversation on Loop Junior. So there will be an event post, and you're more than welcome to comment and continue that conversation there, and leave your information so the group can get in touch with you as well. So now just some final things. For more information about the Fall Prevention Community of Practice, you can visit Loop Junior at junior.fallsloop.com. And I has also included some Fall Prevention Month links in the chat box there as well. And when the webinar has ended, you'll be redirected to Zoom and invited to participate in just a quick short evaluation survey. So how to do that is by clicking the blue continue button on your browser, and then you'll be redirected there. And as always, we appreciate any kind of feedback so we can continue to offer webinars such as this one. So that pretty much brings us to the end of the webinar. Thank you all again, and hope you have a wonderful day. See you next time. Thanks, everybody.